Hey, everybody, welcome back to Dental Unfiltered. I'm Matt Brown. I'm here with my normal co host, Dr. Andrew Vallo. And this is an exciting episode for me because I have this conversation about this subject all the time. And the subject is about patient follow up. Um, you know, I think that there's kind of two trains of thought with this, and or two ways this happens, maybe is better. I think that, doc, you believe there's follow up and there isn't. And I think people just say, oh, we have a follow up strategy. And there really is no strategy. I talk to office managers all the time when I'm trying to diagnose problems in a practice, energize. Oh, I want to say amazing. When I work with a practice, we get really into the weeds of this stuff because they're spending a lot of money on marketing and we have to capture every dollar. And what I will tell you is a lot of production happens on follow up. And I'll be on a call with an office manager and doc, and they'll say, oh, we follow up on everybody. And I'll ask this question. I'll say, cool, explain to me your follow up SOP and process. And then they're looking at me like deers in headlights and they can't articulate it because there isn't one. It's just assumed. And doc, you're assuming this is happening. This is kind of like a work on your practice, not in your practice scenario. Like you should go to your office manager and say, hey, you don't have to design the follow-up process. Don't get into the weeds of it. But go to your manager or your front desk person and say, hey, can I find out how we're doing follow-up? And can you bring me like the SOP for it? And let's see if it's good and working and see if we can come up with a better strategy. In that scenario, all of a sudden you're gonna get a new document that never existed, or you can get one that was never used. And when you start fact checking this stuff and back checking it, you're going to find it isn't happening. When I say it's not happening, I'm going to tell you, I believe it's like more than 8 out of 10 practices. And I'm telling you this, there's a lot of production that happens on follow up. This is the deal. No one goes to your practice as tire kickers in dental don't exist. If they left to go somewhere else, it's because they want to think about it or they want to check your prices. And price shoppers do get treatment. Okay. And you're not the new Chevy dealership. You don't have the new Corvette. No one wants to test drive your 8X chairs. These people have to be followed up on. And it's a massive, massive failure point. So if you're hurting for production and your schedule's falling apart, this is the thing you're not doing. So Andrew, I know you have like an amazing strategy across 10 practices that is architected with intention and built and tested and proven. So let's get into this a little bit and how you like to approach it.
Guys, I think this will be one of those super impactful episodes. I can almost guarantee if you follow the detailed SOP that I'm about to give you, you're going to add an additional 10 plus patients a month to your practice. So, I mean, anybody out there want an extra 10 patients a month, just listen to what I have to say on this episode today and put that into practice at your office. Before I get into that, though, guys, I do have a quick ask of you. I usually let Matt handle this, but Matt and I had noticed that, we haven't gotten a whole lot of reviews in the podcast lately. And obviously, again, as we always mention, we don't get paid for this podcast. We do this for you guys. It does make it more impactful for us when we see feedback, when we see people are enjoying the podcast. And we know a lot of people are listening. We see the stats, it's available. We see that we have a few thousand listeners for every single episode now, which is amazing. But at this point, I think we only have 100 or I don't know, maybe 200 across platform reviews. So my ask of you, if you've been enjoying the content we've put out over the last 2 years and you haven't left a review on the podcast yet, please do me a huge favor. And I'm going to do the same thing that we do in our offices and how we've gotten thousands of reviews in our dental offices. I'm going to ask you guys, pause this episode for 1 minute, go into where it says leave a review and just leave us a quick review with some feedback about, what you're enjoying or what your favorite episode is. We'd really appreciate it. Honestly, I think it does mean a lot to us because we do spend a good bit of time coming on here and sharing all this information with you guys. So again, I know it's a big ask, but if you haven't already, if you could just pause, leave us a quick review. I think Matt and I would love to, see 10 or 20 new reviews after this episode comes out. That would 10 or 20 out of a couple thousand listeners. That would mean a lot though. It really would mean a lot to us. So, all right, that's my little sales pitch for today. Let's get into it. So, the main purpose of this episode is how are you following up with patients that are running late or no show for their appointments? This is not necessarily about following up with unscheduled treatment. We've done episodes about my 222 and how my treatment coordinators are trained to do their treatment follow-ups. This is more for capturing those people that miss appointments, and typically it's new patients, although you have existing patients that miss recall and things as well. We don't have a whole lot of treatment patients that miss because they all have significant deposits and they don't want to lose that money. So that really does help solve that problem for us pretty well. But we don't charge deposits for new patients. We don't charge deposits for recall. I don't want to create those barriers coming in the practice. So we need to have a system in place for how we follow up with those people that miss their appointments. Basically, it's 3 steps. And so I'm going to go through in detail. Step 1 is to try to capture their attention near the beginning of their appointment. So, our SOP, step 1, patients that are running late, within the first 5 to 10 minutes of them running late for their appointments, somebody at the office is supposed to pick up the phone and call them. That's the best. If we can get them on the phone, we can talk to them, figure out, are they on their way? Do we need to push their appointment a little bit? Whatever's going on. If they don't answer, they are then supposed to leave them a voicemail. And then immediately after hanging up the phone, they're supposed to get on Flex and send them a text message. And we've got scripting, but basically the scripting says like, hey, are you on your way? We can still see you for your dental appointment if you're running late. I don't want you to get billed the no-show fee. Please respond if something came up and you need to make a change to your appointment. So, we've got that scripting in place that goes out. I will say a good amount of people will respond either, to the call or to that initial text message. And if something did come up, we can typically get them rescheduled on the spot there. We will typically waive the cancellation fee for non-treatment appointments, assuming that, they're not a repeat offender there. And so, the cancellation fee for new patients hygiene, it's $50. More often than not, we're willing to work with a patient if it's the first time. But that's step 1. So, and if you're not doing that in your office, if you don't, and one, you need to have that SOP in place. People need to understand why it's important that we do that. And then you need to audit it. You need to make sure, like, go look at the patients that are running late or aren't showing up and like, is there something in the call log? Did somebody call them? Did a Flex message go out? And if that's not happening, then you need to remind your team, hey guys, don't forget about our SOP. This person was never called. What's going on? That's step 1. Step 2, before everyone leaves the office for the day, everyone who did not show up for their appointment and who did not, answer the phone call for running late or respond to that text message is supposed to get another Flex text message from the doctor saying, hey, this is Dr. Smith. I wanted to reach out to see if everything was okay. I noticed you weren't able to make your dental appointment. I'd love to get you rescheduled. Usually we'll mention, we've got this promotion going on right now or whatever it is. Let's get you rescheduled for a free consultation. And we'll do this whether they were scheduled for like a hygiene appointment or, new patient, whatever. Let's lower the barriers. Let's just get them back in so they can see the doctor, do a free consultation, and see if there's any way we can help that patient. They're supposed to actually give them dates and times to come in. So not just like, can I get you rescheduled? My next appointments available are, and give the soonest available. Do you have stuff available tomorrow? The next day, whatever it is. And usually they'll give them 2 to 3 days with a couple times. Which time works best for your free consultation? That's step 2. Step 3 happens the following day. And so, I know some of you are thinking, man, like that's a lot of communication. You guys are like overloading the patients. But here's the thing, guys. We need to capture people's attention while leads are hot. So especially for new patients for consults, obviously at some point in the recent past, they made the decision to schedule a dental appointment for one reason or another. If we wait too long to follow up, they may have went to another dentist and got the work done already. 2, they may have had something else come up in life that now takes precedence and is more important. Or 3, if they're fearful, anxious, They may have briefly kind of gotten up the courage to make the appointment and then kind of lost it again, and they may not go to a dentist for another 5 years. So the longer we wait to do these follow-ups, the harder it gets to recapture these patients' attention. So I always mention, one of my favorite sayings: you got to break a few eggs to make an omelet. So just like with our review requests, like, does this annoy some people? Yeah, maybe, but honestly, the ones who it annoys are probably ones that weren't going to make another appointment anyways. So it is what it is. What it is. You can't be afraid to mildly annoy people. You've got to be a little bit persistent. So again, step one: phone call, voicemail, text as they're running late within the first 5 to 10 minutes, ideally. And maybe it doesn't happen every single time within the first 5 to 10, but like that's what my team is shooting for. End of the day, follow up text from the doctor offering times to reschedule. And then the next day, our VAs, our virtual assistants, they go back to the day before for each of the offices. Each one covers typically a couple offices. They go back to the offices from the day before. They look at the schedule. Any patient who no showed, they look at the comm log. If that patient has not responded, they have not rescheduled the appointment, they send a third final message that's basically saying, like, it says like, hey, any fun plans today? I wanted to follow up, from this dental office. I don't know if you were aware, but we have this great promotion going right now for this. Usually we say running this month, let's get you rescheduled for a free consultation so that you could take advantage of the promotion before it ends. Our next appointments available are dates, times, which time works best for you. So that is our 3-step follow-up process for patients who are running late or no-show their appointments. And I'll let Matt kind of take over and give any thoughts, questions, comments, feedback, all that good stuff.
Yeah, I think there's this whole thing with annoying patients kind of drives me up the wall. You know, I think a lot of times, so I'm thinking from the office manager point of view and the doc point of view. When office managers say, "Oh, we're not going to annoy our patients. We're not doing that," you're lazy. End of story. Patient communication is a fundamental of patient care. Um, Back to what I always say: our job or your job is what's best for the patient all the time. Isn't what's best for the patient to get them in and get the dental problem solved? It is, right? So what you're saying is you're really lazy and don't want to do it. And your excuse is we don't annoy our patients. Second of all, let's take it back to the consumer behavior. How many of us get those phone calls and texts every day? And if we don't want it, it just goes down in the text log. It gets buried amongst all of our texts, right? It's such a consistent consumer behavior today. It's not 2005 to 2015 where this is a new thing. It just happens all the time. And so what is the outcome that you're worried about with, let's say you are annoying the patient. What is the outcome that you're worried about? Do you think because you sent a text, a patient that values you is going to be like, oh, got the text now. I'm done going there. No, they're not. There's no negative outcome really to it. And like you said, the ones that don't do it are the ones that like get annoyed with it are probably the ones you don't want. They leave you a bad review anyway. They're the cranky people.
Man, there's no perfect system. And I'm not going to sit here and say that there's never been patients that have, given feedback, hey, all these texts are annoying, quit blowing me up. I'll call you guys when I'm interested, what. Yeah, that happens sometimes, but you can't be afraid of that. And I think in today's world, we are always, we're walking on eggshells. We're tiptoeing around because everyone is so worried about offending somebody else. Here's my take: you are way more likely to lose a patient by not following up with them than you are to lose a patient by following up too much.
100%. 100%.
That's how I view it.
That is a complete fact. It's I think part of what you said was there's no perfect system. I think what is imperfect is to not have a system at all. Right? Like we go into this and like the 222 is a good rule, but I feel like if I ask you what is your process for follow-up or your SOP, you say, "Oh, 222." You spit it out. What else though? Like you just spoke, Andrew, in layers, and then the layers were based on a few different consumers, right? Like you have different strategies based on who the patient is and where they are in the process, right? And I think that's very intelligent. I think that people, and the thing is, I think the flawed thinking is, how are we going to keep up with this? And in today's automated world and the way you're doing things, if you build the strategy and put it in place, it will, even if a couple parts fall apart, it'll still be more effective than what you're doing now. And I think people look at it as this mountain and they're like, well, how am I going to follow up on all these patients? You're not. The point of what Andrew said is you're going to do a little bit of it, but you're really not. And having that structured, consistent system, there is no perfect. But what I will say is there is effective. And some patients will actually value it. You're saying, "Oh, I don't want to annoy that patient." You're gonna have patients. I've had this happen that I've heard on phone calls and seen on text messages. "Oh, thank you so much for contacting me. I overlooked that. It's really important to me. Thank you so much." There are patients that will say that.
Well, it's funny you mention automation because I'm going to go ahead and I'm going to put Flex on the spot here for a second. So Craig and team at Flex, I've been asking them for a while, probably for the last 6 months here now, if they can roll out a feature that you can turn on and off, just like all the other follow ups and stuff in Flex. But can we add a feature that sees that a patient is running late for an appointment and sends out an automatic text asking, "Are you running late?" Because here's the thing: if we do that, then at least if my team is so busy at that time that they can't pick up the phone and call that patient, right away, at least they're getting the automated text. And that's one less step my team would have to do. So again, Flex, if anyone from your team is listening, hey, can we make this happen? I know you guys can do it. You've done all kinds of other great automations. But that would help me out. That would make this system easier for us. I would take some work off my team, and that would help ensure, even if the phone calls are delayed, at least that automatic text is going out. Now, it would be tougher to do the automated text for the other follow-ups where I'm actually asking for specific times for them to reschedule. So that one might be more challenging. That one will probably have to keep my team doing internally, our VAs doing their follow-ups. And you can use it like what we do. You can utilize a mixture of automation, when possible. And maybe there's other softwares up there, PMSs, patient communication, that do have that feature of the automatic text about run. I think it's a genius idea. I thought of it, and I don't know why they've been so hesitant to add it. So sorry, Flex, going to call you out a little bit here, but I love everything else you do. It would be really, really nice if you could add that feature for me. And guys, if you use Flex, why don't you email them and ask them if they could add that feature? I bet if enough of us email the Flex team and say, "Hey, I'd really like this feature," maybe they'll start listening. Maybe my voice isn't quite powerful enough yet.
Yeah. So going back to that, I also believe this. Okay. Let's say you don't have a follow up process, right? I have found that based on the reason why new patient consultations and existing patients that need a good amount of work, all right, I have found that staff choose who to follow up on and who not based on the outcome of that conversation. So when someone says it's like too expensive, they don't follow up. When someone says my husband or wife, oh, let me tell you what, they are the least followed up on people. And I'm going to tell you that we have like 37 practices or more now, but that number is probably old in Houston, right? And I have seen patients who said the husband or wife rebuttal, and they go to another one of my practices 10 minutes away, and they get big treatment. And the reason why, and they go there for a first consultation to get a price also, but then I see the follow up. They follow up, right? Your staff is also, they are skewing the population based on consumer behaviors in the operatory, and your staff should have no input over who's followed up on and who isn't. And that's a bad behavior.
If somebody was in the office belligerent, cursing at your, like, okay, like there might be those few exceptions, but other than that, there should be no discrimination. Everyone should be, everyone who didn't show up for an appointment should be followed up with. Everybody who didn't schedule treatment should be followed up with. You shouldn't be cherry picking or picking and choosing or some days doing. And the other thing I'll say, drives me crazy when I go into our Flex system and I see, a patient responds why they can't make it, and sometimes they don't even get followed up with. Like, it's like we just accept that, like, "Oh, you guys are too far." And it's like, if I see that, I'm like, "Oh, well, we've got multiple locations. What area are you in?" And blah, blah, blah. Or like, oh, we have patients that drive from 2 hours, because they can't find a dentist as good, or, what that can beat our prices. So like, I think people too easily give up on objection. That's something we've trained our treatment coordinators to overcome when presenting treatment. But you need to train your teams to overcome that when talking to patients about, why they can't come to their appointment and things like that as well. So that drives me crazy if I see that. And again, like you've got to, I'm not telling you guys that you as a dentist personally has to do this, you as a business owner, but you've got to train your teams, and then you've got to, either you or someone else has got to audit it. So you've got to make sure somebody who's not actually doing it.
First of all, doc, it's your money on the line. You spent some kind of money to acquire these patients. If you're not checking, that's like giving your stockbroker money and never looking at portfolio.
People complain they don't have enough new patients. People complain about how much it costs to get new patients. And yet we give up so easily when people don't show up for appointments. So think about that. Think about, man, I really wish that I could get an extra 10 new patients a month. Well, do you think if you followed up with all the new patients who scheduled appointments but didn't show up, you think maybe you could recapture 10 of them? Or I really want to get my cost per new patient down. If you followed up with all the people who didn't show up for appointments and you got some of them to reschedule, do you think your cost per, new patient who showed up will go down? Yeah, absolutely. So it's like, we complain about these things, but we're not willing to put in the effort or the systems, or the processes to make it happen. The reason this is a topic today, guys, as always, it's something I'm dealing with currently in my group. We've had this system in place now for a while. However, we added 6 offices in 6 months. We have some new faces in some of the offices, and even the offices that have been stable for a while. Sometimes people forget, get busy, get out of the habit of doing things. So I was actually auditing our follow up process for our offices earlier this week, and like, I was kicking myself when I realized how many offices either weren't following it like almost at all, or weren't doing it as consistently as we like. And then some of them, the funny thing is, the offices that are busier, you see they're doing a great job with these follow-ups. So like, that's what really killed me, is some of the offices that were like doing the worst job with the follow-ups were the office managers that were like complaining like, hey, we don't have enough new patients lately, or the schedule's been light. Okay, what are you doing about, why aren't we following the follow-ups, the SOP for the follow-ups? Like, that's crazy. You guys have some extra time in the schedule, so there's no excuse not to be doing these things. So I had to send out an email to our entire organization and spell out the SOP again. Hey, if anybody has not seen this yet, if you're a new team member and you weren't trained on it yet, I want to make sure everyone is fully aware. This is our SOP that must be followed in every office for every single patient who's later no shows an appointment. And by the way, I audit this from time to time, and I wasn't really super happy with my recent audit. So I'm going to be auditing this more frequently. And if I see that your office is not consistently doing this, I'm going to have a conversation with the office manager. So like, I called them out on it, and I kind of let them know. And I'm sure, some people probably weren't happy about that, but like, guys, as a leader, this needs to happen. Unfortunately, again, I get it. Offices are busy. People are busy. Sometimes people prioritize things that are different than your priorities. My priority as a business owner is capturing as many patients into our office as possible. And some of the other things that our teams might be focused on might not be quite as urgent or quite as important. And sometimes we need to help them shift their focus, or remind them why certain SOPs are as important as they are.
I think there's actually two metrics here. I think, yeah, patient acquisition cost is critical. A lot of these people you've already acquisitioned, right? So I think about it differently. Patient cost of patients who do production.
I think of it as I don't think of it as acquiring a patient unless they come in for an appointment.
But there's also the follow-up costs on the patients that had been in, the other behaviors, right? So I'm talking about, so if we talk about it from a non-new patient point of view, a patient you've acquired, your team has invested in time. We've done an intraoral scan, CBCT, whatever it is, and they either missed an appointment or they didn't schedule or whatever it was. You invested in getting that, not just in money, but in labor and time in the chair. Now, if you take that number and divide it across the patients, and then divide it across the patients that you actually do follow up with that show back up, that's a big investment. And by not having follow up, like docs always say to me all the time, this drives me nuts. They go, oh, all these patients do consults and they're tire kickers. I waste time in my chair. Well, you have other patients who you're not following up on, who you have a relationship with, who you've invested in, and you're so focused on this, you're being lazy over here, not trying to get your investment back. You're burning money on the other side.
Well, yeah, and once again, I think that is the other type of follow up, which we do have episodes specific to that. So, guys, if you're listening to this episode and you're like, man, I really love to learn more about how you do your follow up specifically for unscheduled treatment for patients that have already come in for consultations or exams, go listen to those episodes. I think we've got a couple about uh 222 unscheduled treatment follow up. We've got stuff about sales, treatment coordinator training. So I think we've got a couple different episodes that really go into detail about how our treatment coordinators do what they do, how they do their follow ups. We mail out letters at the 2 week mark. So that was something new we added that's been very effective for that we got from Kelly Schwartz. So I always throw him that shout out for that. So again, that's not my point of this episode. We do have episodes talking about this, but it is the same general idea of why spend all that money acquiring patients to come in your door if you're not going to follow up with them. So you can't just take one attempt, swing and miss, and give up. I mean, think about it. Like in baseball, you get 3 strikes.
There's also batting averages.
Well, right. But I'm saying, like, think about it this way. Whether you're thinking about patients who schedule an appointment and don't show up, or patients that show up but don't schedule treatment, that's like strike 1. That's like, okay, you swing and a miss. Do you just walk out of the batter's box at that point? Do you say, okay, we didn't hit a home run at bats over? Or are you going to try to get back in the box and have those other 2 strikes? So my point is, we can't just take one attempt, say it didn't work, and give up. We've got to make multiple attempts to get patients to show up for an appointment, to get patients to schedule treatment. One attempt is not going to be enough for most people. And I can't tell you how many. So again, when I saw this the other day, I was like, are you kidding me? I personally, as I'm saying, I'm behind on my to-do list. I personally probably spent like 2 or 3 hours going through a couple of our slower offices that weren't doing a great job. And I personally sent text messages to follow up with a bunch of patients who no-showed appointments from the last month or so. And I scheduled like probably 6 to 10 patients at least for each of those couple of offices. I mean, how much value could that add? One of those patients could be a $10,000 treatment. So, again, and unfortunately, my teams were just kind of letting those people walk out the door without any, second effort to get them to come back in. So
I think it's like an out of sight, out of mind thing. Like we get very tunnel vision on like the patient in the waiting room, the patient asking for medical pre-auth, the patient needing meds, the patient in the operatory. That like when they leave, they go off into the ether, and it's like, oh, what was that? Like that person, and then like it's 4 days later, like who was that person that was here Monday, and they needed those 3 implants, and what do we what because I hear docs say this all the time. They walk up to the staff like, hey, that person, because a lot of times the doc doesn't know, right? And they walk up and they go, hey, that person we had Monday, I can remember their name. They needed 4 implants. They had a really good bone. Whatever happened with them? And the office manager's like, I have to look into it. Well, once a couple days go by, you don't remember who they are. And if you don't have automation, if you don't remember who they are a couple days from now, how are you ever going to follow up with them?
I think this is going to be a shorter episode, guys. I don't have a whole lot more to say about this topic. I don't want to keep beating the dead horse. I guess, again, like big picture, what I want you to think about all of the other businesses out there that think about how often you get follow-up emails from other businesses. I mean, there's certain ones that literally will send emails like almost every single day. And like, I get it. At some point, it does get obnoxious and we hit unsubscribe and all that stuff. But like, why are we as business owners so afraid of trying to capture these leads that we already have? That is my big picture takeaway is like, if you don't have any follow-up system in place, you are letting tens of thousands, hundreds of thousands, maybe millions of dollars walk out your door, depending on the size of your practice. So you got to start somewhere, get some system in place. Maybe you don't want your system to be as aggressive as mine. Maybe you don't want to have as many touch points as quickly, and that's fine. Customize it for how you want to do it. All I can tell you is that when my team follows our SOPs, it's very effective at getting patients rescheduled for appointments. When my team follows their SOPs for the 222 follow-ups, it's very effective at getting treatment scheduled from patients who didn't schedule at their initial consultation. So that's I guess that's my takeaway for you guys. That's my soapbox today. As always, if you guys have questions, if you want me to send you the exact verbiage that I talked about for these things, I'm happy to do it. Just give me some grace. It can take me time to get back to some emails, but you're welcome to email me, docvallodds@gmail.com. As I mentioned earlier, guys, if you listen to this whole podcast and you haven't stopped yet to leave us a review, please do me a favor. Again, Matt and I invest hours every single month into bringing you guys, new content. I kind of delve into all of my tips and secrets and SOPs. If you can take 1 minute and just leave us a review, share the podcast with a friend, we really, really would appreciate it. We love seeing your guys' feedback. So that's it from me today. Matt, anything else on your end?
It's me and Andrew do this out of passion, guys. Please leave us reviews. Like earlier, a couple episodes ago, I mentioned the guy that stopped me on the plane, made me feel really good and motivated me to keep doing this. We read your reviews. One, we value the negative feedback. Somebody left a review early on and that said, "Tell Matt to shut up and talk less and let Andrew talk more." And I adjusted, and I asked Andrew questions and kind of did it like a Q&A subject, and it worked out a lot better, and people left really positive reviews after that. Guys, we have no ego about this. If you don't leave reviews giving feedback, leave positive reviews. Both are super valued. They both motivate us and get us excited because that means you're listening and it matters to us. So, guys, thank you again for joining us. I hope you guys have a great day, and talk to you later.